Welcome back to AM Buffalo. Now we have a story. It's kind of an inspirational one because while it starts talking about suffering, I think it gives people a way out, right, of that suffering.
Yeah, I mean, for nearly 2 decades, Buffalo resident and strength and conditioning coach Bob Bateson, who you may know because he owns Body Blocks Fitness downtown, he was putting off getting a knee replacement, which I think a lot of people, when they have knee and hip replacements, they put it off. I know my mum's husband, Peter, he had 2 hip replacements. And yeah, and it's, once you do it, it's a great thing. But then also you want to know who to go to. And Bob turned to a doctor actually in Chicago, out of town.
This is Dr. Richard Berger. He's a well-renowned orthopedic surgeon, and he's known for his minimally invasive approach to hip and knee replacements, which allows for a quicker recovery. And this is the story of what Dr. Berger was able to do for Bob and what Bob experienced heading out to Chicago for surgery. Take a look.
After years of suffering the effects of one too many tackles on the football field, Buffalo local Bob Bateson, owner of Body Blocks Fitness, decided it was time for a knee replacement.
Your body is your business, obviously, so picking the right doctor was very important for you, I'm sure. Why did you pick Dr. Berger?
The biggest thing was his product was far superior, and I interviewed other docs and saw other products at the same time, and I went with Dr. Berger, who I'd followed for about 12 or 15 years, because of his research and his ingenuity and development. Being an MIT engineering graduate first before he became an orthopedic surgeon, gave him the knowledge to help invent different tools to do this minimally invasive work on knees and or hips.
So about 20 years ago, I invented minimally invasive hip and knee replacement. That's doing the same procedure with a different technique. So we don't cut the muscles, ligaments, and tendons. That results in less pain, less swelling, a much quicker recovery, and less need for physical therapy. Basically, it just gets people back to their lives quicker.
My recovery to about full range of motion, extension and flexion, was about 5 weeks. And that's with the new knee. That could not have been done with that weight with the old knee. Too much pressure on the joint.
Dr. Berger, tell us about BEST, your virtual concierge service.
BEST is a program that we put together. It stands for Berger Elective Surgical and Telemedicine Experience, where we marry together surgery and telemedicine. So patients will see us via the computer initially, we'll set up surgery. They'll come in and have the surgery with us here in Chicago, but then they'll go back home right away and we'll follow up with them via the computer. They'll do physical therapy if they want via the computer as well. So it makes it very easy for them to get us to see them and take care of them from any place in the country, in fact, from any place in the world.
As far as him being out of town, that protocol, his staff is so on point with staying in touch with you. They're like a phone call away and they respond immediately. It was kind of like, I was super impressed with that. I felt like I've known them forever. That was really cool. Because, going out of town for a major surgery is not like on everybody's #1 list, right? You want to stay home where it's comfortable and your family's around you. But I would do it again and recommend it to anybody due to his procedure and the follow-up that he has with the staff.
The computer and telemedicine has been now the great equalizer. So patients can get world-class surgery no matter where they live easily. So they can come and see us and have surgery with us and make it easy from any place in the country, any place in the world.
Well, you've performed surgeries on some big-name sports people and also celebrities, including a former president, George W. Bush. How have you become so successful with your technology?
I've been very fortunate to meet a lot of wonderful people, some famous politicians, and that's been fantastic. But really, it's the patient who is a teacher, patient who is a nurse, who wants to get back to work, wants to get back to their life. That's really, really rewarding. Patients seek us out who want to get better quicker.
With Bob, he of course is an ex-athlete. He has a gym. He's very aware of his health and his body and all of this sort of stuff. And it seems like a no-brainer for him to go and get a big surgery like a knee replacement. But what do you say for people who are just everyday people who are maybe thinking, well, you know what, it's not my job, I can hobble around, and they put it off?
Patients come in asking me the same question, is it time? And usually patients have waited too long. They've stopped doing many of the things that they love. They have pain. They can't get out. They can't do the activities they want. Some of them can't even take a walk around the block. I tell them to do the surgery, take back their life. One of the wonderful things about the virtual telemedicine, it allows loved ones to be involved. And it's really been remarkable. In fact, we had one patient not too long ago where he was in Mexico, his daughter was in Paris, and we got them together on a Zoom call and discussed everything, and everyone was involved, and it was just wonderful for their entire family.
You want max movement on all your body parts, trust me. Right? Don't ever give them up, you know?
So awesome.
I bet you there are plenty of people out there going, oh my goodness, I need to make an appointment. Well, the number right there, 312-432-2557, or just visit outpatienthipandknee.com. Wow, I'm sure there are plenty of people who are going to think about that.
It's so amazing.
More information.
Yeah, it really makes you think, like, don't put it off. Like, you know, quality of life is so important.
That's right.
Actually, an interesting thing that Bob said to me, because we had a really long chat and I couldn't get it all in the story, but he said he did a lot of research into, you know, as you would, because it is a major surgery. He said that one thing that Dr. Berger does is, because he's invented the knee joint that he puts in you, he's made different ones for men and women, because we've different anatomy, and a woman's knee is like, it needs to do different things, just the way our hips are shaped and stuff like that. So, you know, definitely worth checking out this doctor, and don't be put off because he's in Chicago, because as Bob said, it's like really easy to do it, especially with telehealth these days.
Yeah.
You know.